So thank you for everything. I will go ahead and actually invite Lorina to please join us and unmute yourself. You can start your screen share as I introduce you. So please welcome Lorina Hoxha, Senior Project Manager of Transportation Equity at the City of Toronto. Lorina is a Senior Project Manager in Transportation Services Division, where she leads the division's Transportation Equity Policy Development, Research, and Evaluation. So as a policy professional with a background in urban sociology, Lorina's work focuses on identifying, measuring, and improving social outcomes of urban infrastructure and service planning, particularly in the transportation and housing sectors. I've had a pleasure of working with Lorina now for many years on a number of projects, and we're very grateful for you to share your time and come tell us about this exciting work that you've been doing with the city.
Thanks so much for the introduction, Steve. And hi, everybody. I'm really happy to be here and sharing some of our work with you. This presentation is about a project that we started at the city earlier this year, which is a citywide transportation equity policy framework. And the title of this talk is Building a Shared Approach, because our core team consists of staff across transportation services, city planning, the Toronto Transit Commission, and the city social policy division, as well as some academic researchers from Mobilizing Justice, including Jamie Fisher, Antonio Pays, Anastasia Sukov, and Brent Anderson-Gregson, who have been a really invaluable source of guidance and support for us throughout this process. So before I get started, just wanted to declare myself as a big MJ fan. So I'm going to provide just some background on the project before spending a fair bit of time on our conceptual framework, because my understanding is that there are slightly more academics than usual in the crowd. And then I will talk a bit about how we're trying to apply some of this conceptual work to methodologies and tools that we're developing. So to start with some background, this project really began for us with the recognition that there was a lot of consensus at the city that equity was critical to doing our work well, but very little clarity about what exactly this means and what it entailed for our decision-making more concretely. We were getting better at incorporating equity in some capacity, often as a supplemental consideration, but the impact of this wasn't really being measured, and there was no transportation equity-based performance targets or broad policy goals that we could reference. Staff also often expressed that they were unsure about how to weigh equity alongside more established transportation priorities like safety. And much of this was due to a lack of established best practices or standards for the huge range of projects that we deal with and how to think about these various priorities together. So all of these factors really pointed to a need to become more rigorous about how we were doing transportation equity work, recognizing that this is a really complex and distinct field of research and practice that we weren't just going to sort of passively pick up, and we needed to dedicate time to incorporating it successfully. So the framework really emerged as this proposal to put concerted effort into getting aligned across our various groups on the principles and methods by which we'll be doing this work citywide, establishing equity as foundational to our decision-making, and developing a guidance and set of tools for staff to apply. There are three main components to this project. So it's divided in three phases. The first is conceptual and policy foundations, which is the one that we're currently in, methodological guidance and target setting. This is the one that we've sort of been greenlit to do by senior management, and the rest we'll see based on how the outcomes of this first phase is. But this first part is really focused on translating academic research to the policy context, doing some research on locally specific conditions, establishing shared definitions, vision, and principles, and determining priority groups. We haven't been able to avoid also getting into the second part around collecting and developing indicators and metrics, just because it's so related to the policy work. And this second phase is really about how we will operationalize all this conceptual work into methodologies and strategies to institutionalize equity analysis. And we also want to provide some guidance, some broad guidance for staff on how to use different methodologies and tools for different types of projects. Finally, the third is target setting and progress monitoring. And this is where we hope to establish policy objectives, equity-based transportation performance targets for things like access by different modes and proximity to the network. since so much of this work is really about defining how things should be, and ultimately reflects the city's values, we think this will need to be defined through a robust community engagement process. And we see the work that we're doing now as kind of laying the groundwork for that engagement by assessing current conditions, articulating the principles we think are key to these discussions, determining what's feasible, and building the tools we need to pursue ambitious policy goals. I want to provide some quick background on the Transportation Equity Index, or version 1 of this, that we'd completed in early 2022. This attempted to quantify transportation inequity across the city through 27 indicators across these 4 categories. Our intention was to revise and update this, and this is actually what ended up prompting conversations about doing so as part of a larger policy project. Because without being embedded in a policy framework, this tool kind of existed in a vacuum, and we had to constantly sort of rearticulate how to use it for different cases. This is just a preliminary structure, still a work in progress for what version 2 of this index will look like. We are likely to expand some of the demographic groups we're considering. But the major difference is that we are separating this from these 5 different areas of performance measurement. We are considering not just walking access, but cycling access and transit access to various destinations, making some distinctions between the destinations we think are important to be able to access by each mode, where walking is a bit more local and transit is a bit more citywide. We're also developing some indicators around infrastructure and service distribution that measure our access to different types of transportation facilities, as well as the quality of those facilities. So things like accessible public rights of way, all ages and abilities cycling facilities, and high frequency transit. And then lastly, we're looking at transportation externalities or burdens. This includes killing and serious injury rates, air pollution, and noise pollution, which were in version 1. We're also looking at heat exposure and vulnerability to transit-oriented displacement. The way that this data will be combined is through a sort of simple matrix where the highest priority areas for us will be those with high numbers of vulnerable populations and relatively unsupportive built environment. Of course, areas with low numbers of those populations and an unsupported built environment are still areas of interest for us as built environment professionals, but this is where our focus is because we assume that there's less capacity to adapt or overcome the challenges of that unsupported built environment through private transportation options and other means. So these were the guiding questions for phase 1, and I'm going to use them to structure the rest of this presentation. The first is, what do we understand by transportation equity? What are we distributing equitably and according to what principles? What are the historical and current conditions that shape transportation equity in Toronto? What are all the barriers we recognize individuals face when accessing the network, and what populations are disproportionately impacted? And then how can we translate these conceptual foundations concretely into our policymaking and project and program implementation? So to begin with the question around defining transportation equity, I just want to note that the work of folks like Rafael Pereira and Alex Karner have been really influential in shaping our discussions around this. And a lot of the ideas here are from these really excellent academic works. The first point really is that transportation equity is concerned with how the benefits and burdens of transportation are and should be distributed across society. We recognize a sort of diagnosis function, but also a more propositional one. But we also, when we say transportation equity, we're not limiting this to just distributive questions. We're also thinking about questions of procedural justice. So fairness in the political process, every group's ability to participate in decision-making, and also recognition concerns. So claims to rights and entitlements that are owed to groups based on past harms. So Some examples of this might be legislation, which recognizes the rights of people with disabilities and mandates universal accessibility, or policy strategies that we have at the city. For example, the city's Confronting Anti-Black Racism Action Plan and the Reconciliation Action Plan. Equity evaluations are of transportation conditions or projects generally evaluate what the distribution of these benefits and burdens looks like, how it differs across groups or places, and its effect on social outcomes. We definitely recognize, and anyone who's done equity work recognizes that these are very methodologically challenging, and what may seem equitable using one metric or method may not with a different method. And often this is because of inconsistencies in the concepts of equity and the fair distribution that are being employed. So it is really essential to be clear about what principles we are using, and to define what equitable distribution is, and which we don't think is really a technical exercise, but one that reflects a city's vision of a just transportation system. And this is really not one. There's no kind of final right answer to how we define what fairness is, but only strong visions that are tailored to local conditions with a clear articulation of trade-offs. The second question, so what are we concerned with distributing equitably in transportation and according to what principles? We agreed with Rafael Perez and Alex Renner's assertion that there are kind of four main benefits and burdens, and this really aligned well with what we had previously done in the version 1 of the index. Resources, so transportation infrastructure and services, mobility, the actual trips enabled by the system, accessibility, the potential trips taken based on access to key destinations by different modes, and then externalities or burdens, so environmental health and social externalities that are related to transportation, such as pollution or the traffic fatalities. We also recognize that what shapes questions around distribution are systemic limits, and there are three in particular that we recognize as critical. The one that we're all familiar with, of course, is costs. Governments have limited funds to finance improvements and maintenance of transportation, and must prioritize. Space, there's increasing recognition, especially in cities like Toronto, that transportation inefficiencies will not be solved by expanding road space. And finally, one that we're not as familiar with, or at least not baking into our decision-making processes maybe as much as we should, are emissions. So again, an increasing recognition that private automobility cannot remain the primary mode of transport without catastrophic ecological consequences. So understanding what trade-offs exist between those kind of social and environmental benefits is also an area that we want to explore with this work. Again, this question around distribution is also asking what principles we think are sort of most compelling to shape a policymaking process. I think most in this audience are probably familiar with these three kind of theories, but just to go over them briefly, sufficientarianism is concerned with meeting absolute minimum thresholds of transportation supply or service, and absolute maximum thresholds of exposure to burdens. The implication here is that where service is below these thresholds, public institutions have some responsibility to rectify those circumstances. Precedents like this already exist in policy, especially in health policy, when we think about, for example, WHO standards for access to green space or maximum exposure to air or noise pollution. And thus far, they're less common in transportation, but there are some examples. Namely, Vision Zero can be considered a type of sufficientarian policy. And the popularity of approaches like 15-minute cities really suggests that there is an appetite for more of this kind of thinking when it comes to our policies. Egalitarianism argues that benefits should be distributed to maximize benefit for those in the worst off positions. So even if all are above a minimum standard, unfairness persists so long as there's relative inequalities. Given that we're always working in a context of scarce resources that require prioritization, we think this is a really important way to understand the process of reaching universal service goals by prioritizing where need is greatest and continuing to monitor disparities and opportunity between groups. And we don't think of these two theories as being mutually exclusive or inherently conflicting. The last is not really a distributive justice principle in itself, but more of a sort of intervention in the way that we're having discussions about distribution at all, because it argues that beyond sort of the simple distribution of primary goods, we should be thinking about people's ability to actually convert those goods into things they value. So people have transportation access, but what they really value is their ability to visit their friends or family, for example. Their ability to do this is shaped by their individual physical, mental, cultural, economic, and social circumstances. And this really manifests in transportation barriers like affordability, perception of safety, access to technology, and physical inaccessibility. So somebody may live right next to a subway station and enjoy very high transit access in sort of simple terms, but they might not feel able to use it because of a previous negative experience of sexual harassment, or maybe they don't use it as often as they'd like to because they can't pay the fare. These kinds of issues are poorly captured in spatial analysis and most of our existing methods. And we think this really underscores the need for more qualitative data, for the inclusion of these dimensions in quantitative measures wherever possible, and for ensuring that these sort of considerations are captured in our policies and strategies. Our third question was, what are the historical and present day conditions that shape transportation inequity in Toronto? And this year we commissioned an archival research report on the historical impact and ongoing legacies of transportation infrastructure development on marginalized communities, really seeking to understand whether this US story of running highways through neighborhoods, of causing direct displacement, whether this was a Canadian story and a Toronto story. This project was led by the Infrastructure Institute at U of T, and it was informed by over 250 archival documents of planning meetings and other sources from 1947 to 2011. And it found that, in contrast to the American legacy of harm by commission, Toronto stories really largely of harm by omission, where political inertia, stigmatization of Tower neighborhoods, and deference to affluent homeowners led to systematically delayed and deferred investment, which has left communities underserved for decades. And some of the sort of present day legacies of this is that we see significant disparities in network access, particularly in the city's periphery, which compounded with the suburbanization of poverty lead to conditions of transportation poverty in a good part of our city. And the second is a threat of commercial and residential displacement and gentrification from transit-oriented development. This report is coming out very soon, so check out the School of Cities website if you're interested. Our fourth question was, what are all the barriers we recognize individuals face when accessing the network, and what populations face these barriers? We define priority populations as those that face disproportionate challenges to interacting with the transportation system due to various structural barriers. And a lot of these categories, I think, are common to similar frameworks. But one thing that we did a little bit differently was added groups like non-drivers and caregivers to reflect more transportation-specific equity concerns, or things that have become equity concerns because of the way that our transportation system is, which is predominantly car-oriented or designed to facilitate certain commutes or certain trip purposes over others. So these are various dimensions of disadvantage within which there are a number of groups. So this is our attempt to sort of map these against where we know we have some available data through the census, the Transportation Tomorrow survey, or other sources. And we have some notable gaps, especially around data around caregivers, around gender and sexuality, citizenship, disabilities, and digital literacy. Our next step was to sort of distill all of that lit review into what ended up being 4 sort of distinct barriers to the transportation network. These are safety, economic barriers, accessibility, and participation. Under safety, we have road safety, which we define as disproportionate vulnerability to traffic-related death and injury due to ability-based barriers, access to driving, or poor investment in neighborhood road safety. We have public safety, disproportionate vulnerability to violence in public space, such as gender or race-based harassment that may reduce perception of safety while traveling. We have legal safety, recognizing that transportation is one of the main ways that residents or citizens interact with law enforcement. So disproportionate vulnerability to law enforcement, reducing perception of safety while traveling. Under economic, we have affordability, which points to the direct costs of transportation, which may lead to rationing or foregoing travel. And then housing, which looks at sort of the broader economic and environmental effects of transportation development and how those with the precarious housing tenure or limited housing choice are disproportionately impacted. Under accessibility, we have physical and mental. So we define that as inability, reduced ability, or reluctance to access the network due to barriers related to the physical or service design. And then we have network accessibility, which is defined as challenges to reaching destinations of value due to poor consideration of travel patterns and needs in transportation and land use planning. Finally, under participation, we have inability, reduced awareness, or reluctance to participate in municipal service planning due to practical, economic, or communication barriers or historical exclusion from the planning process. So our final question was about how we can translate some of these conceptual foundations concretely into our policymaking and project or program implementation. And there are 4 examples that I'll go through. So to start off with the demographic analysis matrix, one of the most common complaints that we heard from staff before starting this work was that decisions about using demographic data for different projects felt too arbitrary. Staff were often reluctant to use all of the data, but it felt like too much information, but they also were hesitant for understandable reasons to select certain groups over others. So we tried to build some conceptual clarity around the selection and application of this demographic data by developing this matrix that maps population-specific vulnerabilities to relevant transportation barriers. And the goal is to help staff identify what barriers are relevant to the type of project they're doing. And there's a really huge range of projects that are sort of within scope here, to identify the groups that are impacted and to recommend strategies based on the nature of the project's equity concern. So this is just a glimpse into what this matrix looks like. It maps known barriers to existing transportation system against the priority populations that are likely to be disproportionately impacted. This is just cut off for reasons of space, but it's a much longer list. And the idea is that, if anything, this can serve as a sort of educational tool where staff can hover over different links and see what connects this particular barrier and that population group. So some examples might be children face greater network access barriers, particularly car-oriented neighborhoods with poor road safety infrastructure and limited cycling facilities. Recent immigrants may face barriers to participation due to a lack of familiarity with the existing channels and linguistic challenges. Night workers may face lower perceptions of safety during their commute, especially when walking or riding transit, an issue that's exacerbated by longer nighttime headways. Around sort of capabilities-based measures, that previous example was one example of thinking about capabilities by sort of widening the set of safety concerns that we consider to be relevant to transportation to go sort of beyond just road safety. But other things we've done are try to incorporate quantitative measures that speak to not just the presence, but also the quality of infrastructure so that we can get to some of these ability-based considerations. So CANBIX is the measure that we're using for access to all ages and ability cycling facilities. So because we want to ensure that our measure of cycling access is inclusive of people of different levels of risk tolerance. And competition is also another one. So we've developed a metric of access to bike share, which factors in competition from a nearby population using this method called spatial availability that was developed by Antonia and Anastasia. We also want to explore ways to measure the qualitative elements of the pedestrian network to sort of account for things like comfort and safety. As part of our work, we also want to increase the collection and monitoring of population disaggregated data on transportation outcomes to better understand and respond to issues of relative inequalities. So this is some work that Bren and Jamie helped us with on looking at population-weighted access to employment in Toronto. And we're looking also at things like differences in killed or seriously injured rates for different age groups, and would love to be able to expand the types of population groups we're actually able to measure these kinds of things with. But unfortunately, age data is what we're limited to right now. Finally, we've had a lot of discussions about sufficiency-based broad policy targets. There's definitely a lot of appetite, at least within our project team, for taking a sufficiency approach. And we think that cumulative opportunity measures are a really good way to do this because they are more simple and interpretable and suited to a sort of more public-facing purpose. So things like X% of population can reach Y destinations in 30 minutes by transit, as an example. But we also want to use gravity measures for project level analysis because we value the granularity that they offer and the complexity that they offer through distance decay. And we've considered ways to try and do that while still having sort of established baselines. So one thing that we're experimenting right now is using existing data to develop baselines for high access by walking, cycling, or transit DAs and using these as sort of sufficiency thresholds. Obviously, these are still relative measures, but because we are working within the context of Toronto and we know that Toronto has some very high access neighborhoods, this is a sort of wraparound way of trying to make meaning out of really abstract measures and by sort of describing them qualitatively and establishing thresholds that we can monitor over time.
Lorina,
All right,
I was just about to interject. Okay, go ahead and finish up.
All right, no, this is it. Thank you so much for listening. And if you have questions, comments, or want more information, you can feel free to email me.